So I want to welcome everyone to today's webinar. My name is Pat Monacelli, and I am the Director of Events and Marketing for the Broomfield Chamber of Commerce. Thank you to our panelists that are here today. Thank you to everyone who has opted to attend this session today. We are broadcasting this session also on Facebook Live. Those that are watching on Facebook Live will not be able to ask questions or interact, but they can view the presentation. We're also recording this presentation so it can be viewed later by folks who were not able to make it onto the call today. And that recording will be available on the Broomfield Chamber's Facebook channel. And the Chamber's YouTube channel, and we'll get that posted after the session today. So, again, it looks like, and Jeff, I see your question in the chat. It looks like my camera is the only one that's enabled. I went into the settings on Zoom and I cannot enable anybody else's camera. So I apologize for that. And I'm actually going to turn mine off as soon as I finish with these opening comments. So what we're trying to do today is get together with folks from the city of county of Broomfield and talk about the COVID-19 situation in our community, where we are, what level red means, and what the options are for people who are trying to, especially for businesses who are trying to make the best out of this situation, and what options might be out there. It is a discussion as well as a presentation. We opted for the webinar format for ease of the question and answer. So what we're going to do is we will have Jason Volling from Broomfield Public Health give us a brief presentation about a COVID-19 update and where we are. We have got Jeff Romine from the city and county of Broomfield. We've got Deb from the city and county of Broomfield to give us a little more background and to help us answer some questions. We've also got a few folks that are attendees today that have had to pivot their businesses as a result of COVID-19, and we'll address some of those ideas as well. We will open it up for questions and comments and suggestions. In order to make sure that everybody's question or comment or suggestion gets addressed, what I'd like you to do is, after Jason's brief presentation, if there are comments or questions, please just put your name in the chat. You don't have to put the question in the chat, but please put your name in the chat. I will enable your microphones and allow you to ask your question, make your comment, or your suggestion. I am going to limit those questions, comments, and suggestions to 1 minute so that we can try to get to as many people as possible and we can get as many answers or other ideas as possible going. So just keep that in mind as we move through, and we will get started. So again, I want to get started going to Jason Volling from Broomfield Public Health. And Jason, we just went to level red, and I think everybody here is aware of that and what that means. But from a public health perspective, can you give us a breakdown of where the city and county of Broomfield is in the COVID-19 situation? What's the lay of the land, so to speak?
Yeah, thanks, Pat, and I appreciate the invite from you and Sam and the chamber. We see you obviously as vital partners, and I know I'm coming to you during very difficult times, but my hope is just to provide a very brief overview of where we're at in the COVID pandemic. So if Sarah can pull up my slide deck, and Sarah, if we could go to the next slide. So as Pat was sharing, and as we've been sharing publicly on all of our communications channels, Broomfield has been in the level red of the state public health order dial matrix. We have been there for a good period of time, over a month. We were really worried in the beginning that our cases were going to skyrocket at the same rate that we were seeing in Adams County and other surrounding counties. We haven't seen that, but however, we still are higher than that level orange, which is the high risk area. And we're in severe risk. So you can see that our 2-week case incidence is 647. Our % positivity 2-week average is 9.4. That's how many people that we're testing and capturing the level of virus. We want that to be at 5%. And we've had 12 days of declining or stable hospitalizations. So next slide, Sarah. So just so everybody knows, we saw an enormous steep incline in cases, and you can see this beginning in mid-October, which shot up to around November 21st with that rise. The state moved us to level orange on November 6th. And then we were moved to level red on November 20th. What you can see from this is we had that really steep incline from mid-October to November. We're starting to see a little bit of a downward trajectory, and now cases beginning to slightly increase. We don't know yet the full impact of Thanksgiving. We should, in this upcoming week, have a good idea of how Thanksgiving is going to impact our case rates. Our overall hope is it's not as bad as what has been anticipated, but we'll just have to watch that. Can we go to the next slide, Sarah? So just a little bit of what's happening right now in Colorado and in Broomfield. Approximately 1 in 40 Coloradoans are currently infectious. This is the highest that we've been since the beginning of the pandemic. The CU School of Public Health and the Colorado Department of Public Health and Environment, along with the governor's office, look at modeling data to see where we're at as far as potentially impacting ICU bed capacity or hospital capacity. And they use a term called transmission control. We were at 60% when we saw that steep incline, and now we're seeing that transmission control is up to 71%. Our ultimate goal is to get at 80% to start to get things leveled off, but this is good news. We're seeing contact tracing, isolation, mask wearing, and some of the public health policies are working. In Colorado, and we're also seeing this in Broomfield, the cases are increasing in our older adult population. That's concerning because that's one of our most vulnerable populations. Hospitalizations across the state and also in the metro region have been trending down since December 2nd. We'll continue to monitor that again with Thanksgiving case rates and see if we see that. I would say that I wouldn't hold our hats on that trending down metric just yet because it's a little bit unstable. We see it bouncing around. So as we get a week or 2 more weeks of data, we'll have a better sense if that's a true trend. The other thing is, while we're looking at hospital capacity, either hospital beds or ICU beds, the most important thing is to make sure that we have staffing capacity for those beds. And the reason for that is it's not only for those people that need COVID care that are going into the ICU, but it could be anybody that's going in that needs care in an ICU setting or just a hospital setting, somebody having a heart attack, somebody having a stroke, somebody that gets in a car accident. We know that happened, that hasn't gone away. So that's why we're closely watching the hospital trends and hospital capacity, and hopefully we stay in a place where we don't exceed that. Next slide. So some good news is that a vaccine is on the way, 2 vaccines, I should say. Pfizer has submitted to the FDA to have their vaccine approved. They're actually meeting on the 10th to review Pfizer's data and make a decision. Full anticipation is it'll be approved, and then they'll begin shipping that out to states within 24 hours. Additionally, we expect the Moderna vaccine to start that process shortly thereafter. So as we think about where we're at, yeah, we're in a very difficult time right now with virus transmission and hospital surge. But with vaccines coming, there is hope. And we're hoping by March or April, we'll get to the point where we're vaccinating the general population. Next slide. So we've done a lot of outreach on what level red means. And I think the biggest impact, obviously, and we're fully aware of this, was the impact to our restaurants and bars and gyms. And so you're all aware of what the capacity limits are now. We are continuing to work very closely with the state on looking at level of risks within these specific settings. And secondly, how that may change if, again, we start to see a leveling off with cases in Broomfield or in the metro region, and if we are able to either move on the dial or get to a place where we're don't have as much high community transmission. So next slide. A couple other things that happened just yesterday that we became aware of. Actually, it was the 7th when they issued the public health order. Is they updated it where bars can now offer curbside pickup, takeout, and delivery, and you're not required to sell food to do that. The other thing is, based on the Supreme Court ruling, places of worship are now considered critical businesses in Colorado. They can operate without capacity limits, but still need to follow all of the other mitigation strategies of people wearing masks, achieving social distancing, and obviously the hygiene and cleaning aspects. And then lastly, educational institutions like museums and aquariums were now allowed to operate in level red at 25% posted occupancy, not to exceed 25 people. Next slide. So just some of the key takeaways, and I addressed most of these, so I'm not going to go into them again, but the one I really do want to focus on is that the next 6 to 8 weeks could be some of our most challenging times with this pandemic. That's happening nationally. We've seen it happen in the state and the Denver metro region, and unfortunately, where we sit in Broomfield, we're not immune to that either. So we know with additional holidays coming up, there's the potential for increased gatherings. As people are moving more and more indoors, there's literature out there showing how diseases are actually spread. And then COVID-19 fatigue continues to be an issue that we hear about. And I think we're all at that place of being done with this virus and ready to move on. So thankfully that vaccine is here, and hopefully we get to a place where in the fall of next year, we're at some place of normalcy. And then lastly, just again, our hospital capacity, we just want to keep making sure we're monitoring that so it doesn't get strained. And our last slide shows where you can find resources for COVID. It's at broomfield.org/COVID. We have our Broomfield Weekly Scorecard that we also publish, and we do monthly town halls. We're doing updates to City Council and our Board of Health on a weekly basis. And so we're happy to share any additional information you may need to the chamber. And with that, that's my presentation. So we could close the slide presentation, Sarah. And now, Pat, we're happy to turn it back over to you, and we're available to answer questions.
Great. Thanks, Jason. I appreciate that. So what I'd like to do again, as we are moving through this process, if you have a question, if you are one of our attendees today and you have a question for Jason or Jeff, who is with Economic Vitality with the City of Broomfield, please put your name in the chat. You don't have to put your question in the chat, just put your name. And when I see that, I will open up your microphone so you can ask your question again, or you can comment, or you can give a suggestion. And again, we'll limit those to 1 minute. And so if I see a name in there, we'll get things started. And I am not seeing any questions in the chat as of yet. So what I'd like to do is let you know. Oh, there we go. Luke, give me just 1 second. Okay, Luke, your microphone should be on.
All right, can you hear me?
We can.
Awesome. Hi, my name is Luke. I'm the manager of the Flatirons Habitat for Humanity Restore. And I have been keeping up to date on a lot of the COVID and all of the precautions. I just have the age-old question is there anybody that's exempt from wearing a mask for any reason inside a private facility?
Yeah, Deb, I know you've done a lot. Do you want to respond to that one?
Sure. Thanks, Luke, for the question. This is Deb on the Public Health Department, and there are some exceptions. So under the statewide executive order issued by Governor Polis, which actually was just extended for another 30 days earlier this week, that executive order requires anyone age 11 and older to wear face covering in all indoor settings. And there are a few exceptions, and those would be individuals who cannot medically tolerate a face covering. And so that certainly would be a circumstance, anyone under the age of 11. And then there are some other examples. For instance, if individual needs to show their face for a like purposes of ID verification, and so forth. And so I think there are there guidance as well in terms of, for instance, right now I'm in my office alone with the door closed. I don't have a face covering on. So if you are in a room alone, that would be another example of when a face covering is not required. So there are some exceptions. Hopefully that answers your question.
Yeah, I've just had a couple over this past like 6 months of people just saying they are exempt from wearing a mask and they refuse to wear a mask. And I have given them the option of wearing a face shield, and then the customer ends up leaving the store instead of a face shield.
Yeah.
But I just don't want anybody to be offended or upset, but it's hard to verify if anybody does have an exception, even if they say they do. We do give them other options, but they do end up leaving after putting up quite a bit of a fuss sometimes.
Yeah, Luke, I think what you're describing is you are not alone in those interactions, and it is, I know, a difficult conversation. And so, one of the things in our business toolkit on our website, and you can find the link and chat that in, there are some example scripts that if you do have team members that are, how do I approach this situation, that we can provide as a resource. We have signs that we can get out to you if you need, and I think most businesses have those, but if you need more signage, just to let people know before they even come in that it's a requirement. But I think the other thing too is, and you kind of alluded to this, as a business owner, you have the ability to refuse service to individuals that refuse to comply with the mandatory face covering, so long as you are providing reasonable accommodations. And so there are, depending on the type of business, a number of ways you can do that. Some businesses have the ability to offer curbside or to conduct your business outside, online. providing services virtually. So I think just educating people about those options to the extent that they're applicable to your business is something else, which you're probably doing, but I just wanted to mention that as well.
Fantastic. Thank you much for that information.
All right, thank you, Luke, for your question. And next question we have is Justin. So Justin, let me get your microphone turned on here. All right, Justin, your microphone should be live here any moment now.
Yeah, hi everybody. I have a couple questions for the health department. I'm with Great Scots Eatery in Broomfield. My first question was, and I'm sorry, I was trying to look back through my emails about the program that might let us stay one ahead of the dial. I believe it's called the 5-Star program. If the Broomfield Health Department could tell us where we're at with that, if we should start putting plans together to apply for that.
Yeah, thanks, Justin, for that question. So what the state has been doing is looking at a program, a business certification program, and the pilot came out of Mesa County. It's called the 5-Star certification program. They solicited public comment on it through last Friday. From there, they're going to finalize what that guidance looks like. Our understanding and my understanding of seeing that program is you would have an administrative committee set up that would include public health and the local chamber of commerce, nonprofits, and county commissioners. The committee would then have to apply to CDPHE to be able to stand up the program. The businesses would have to apply for a certification through that committee. And then the committee, the local public health agency, we would be responsible to perform an on-site inspection and review a written plan to certify the business. And then after that, we would be expected to do regularly checked monitoring compliance checks. And I want to tell you, as a public health department, I think this is a great strategy as part of our overall mitigation approaches. I could tell you here in Broomfield Public Health, but just public health directors across the state have voiced two concerns. One is in order to stand up this program, there needs to be resources. Mesa County's program got to a point where they're no longer able to do the certifications on site or to do the compliance checks just due to increased demand. So the state is definitely looking into that as one issue. And then the second issue the state's looking at closely is should a program like this be allowed for those counties that are in level red? And I don't know the answer to that yet. And so as soon as we get the final framework on the program sent to us in public health, we'll make sure we share it with Jeff and Sam and get it out through the chamber to all of our business community.
Okay, thank you. Do you have any kind of timeline on when that might be? I mean, obviously it's just a trial for Mesa County, so I'm just curious if they've given you any kind of like 3-month, 6-month kind of time frame on that.
So they were saying that they were hoping to have the program rolled out. I believe they said have final the final aspects of the program developed by December 14th.
Okay.
I could check in with my state reps and see if that's still the case. And then secondly, again, I think the main question we have in Broomfield is what happens to us if we're a county that's in red? So we'll just have to continue to monitor that.
Yeah, I think I've seen something where if you were in red or purple, you stayed, but then anything below the dial, you were able to move up one, obviously with increased social distancing and a list of other things. But one thing that I read on that list, and I'm sorry, I was trying to find it at the Restaurant Association website, but one thing that came up on there, and maybe you're not sure yet, it did make it sound like if you've had any violations in the past that you were unable to apply for the program. Well, my question there is, so if you've had like a violation that's been corrected on site or through a re-inspection due to, a maintenance issue or something, is that going to disqualify restaurants in Broomfield from applying for the program?
We haven't got those specifics yet. I think the way they rolled it out in Mesa County, my understanding was they first did the certification, and then if you violated the orders after that, that's when you were no longer eligible to continue to participate in the program.
All right, Justin, thank you for your questions. Jason, thank you for those answers. I don't see any other names in the chat right now. So if you want to ask a question, please put your name in the chat. And oh, there's Mary. Okay, hold on just one second, Mary. And you can go ahead, attendees, and put your names in the chat. You don't have to wait for the person in front of you to finish their question. As we build the queue, I will just move to you in order. So, Mary, your microphone should be open.
Thank you. I'm Mary from Backstory Theater. And I guess a question I have for Jason and the team is clarification on where a service like ours falls in the business categorization. So we're not sure if we count as a personal service or now as an ed institution. We operate classes, but they're not as active as like a dance class or a gym setting. So just kind of trying to help figure out if we're following what capacity level we should be following.
Yeah, great to hear from you, Mary, and love the work that you guys do at Backstreet Theater.
I appreciate what you're doing too, so thank you for that.
Yeah, I'll let Deb respond to your question. She's my expert in the public health order, so go for it, Deb.
I know. Well, thanks, Mary, for the question. It's actually a good one. We've been conferring about this with our attorney's office in the state too, because, and I think this, for everyone's benefit, we have statewide public health orders that we are required to enforce locally, and it is sometimes pretty straightforward, and other times I think requires us to really ask questions of the particular facility to understand, because it may depend on the type of activity. So kind of to your point, Mary, is it a recreation activity that would fall under the indoor recreation guidance, which is currently limited at 10%, or is it an educational setting, like an extension of a school setting that would then fall under schools, or is it more of a personal services, a training, which would then fall under the 25% capacity? And then the other thing that we're trying to look at when we're supporting facilities and making these determinations is, what is the setting? So where is this taking place? Is this taking place, at an event center, at a restaurant, and so forth? And so, with Mary, I may end up following up with you directly, because we actually have that question out to the Attorney General's office of under the updated public health order that Jason referenced. It would seem that educational functions, which I think could be broadly defined, what types of education that would be. In your case, it's acting in theater education, that may be subject to this new educational category that can operate at 25% up to 25 people. So I may need to follow up with you directly, Mary, once we have that response, but that may be the category that we end up putting you in. I think I'll just add to my discussion here that, I was saying a minute ago, the types of activities. So if we're talking about an actual performance, for instance, that would be an indoor event. And so if we're something that would have an audience, and so currently under level red, indoor events are prohibited. So we would not be able to authorize an actual in-person performance at this time, but instruction may fall under a different category. So I apologize, Mary, for not being able to give a finite answer here, but we have that question out, and I will commit to following up with you directly.
Thank you, I appreciate that.
Yeah.
All right, Mary, thank you for your question. We're still waiting for some other questions to come into the queue, so I was going to pose one to whoever's the best, and Deb, it might be you. Of course, we've got this Taste It on Tour event that the chamber is promoting, and through some discussions about how that looks right now with capacities at restaurants and things, there seems to be a little bit of confusion among some of our restaurant folks about what qualifies as outdoor dining. And whether or not covered structures, tent structures, those like that are okay or not okay under what qualifies as outdoor dining. I just sense there's some confusion on that. Can you address that?
Yeah, Pat, you are correct. That definitely is a source of many discussions in the community right now, and understandably so. So I think there's two things that I want to address here. One is that under the public health order, the language states that restaurants in level red, restaurants can use existing licensed outdoor space for in-person dining. And so that right there draws a line, because we've had a number of entities that have indoor space that they would like to convert by opening up doors and windows and other mechanisms to increase ventilation, which we obviously applaud, and I think will be important as we return to indoor dining to encourage those practices for ventilation. So that's the first criteria, is just that it has to be an existing licensed outdoor space. So we're not trying to convert indoor spaces to outdoor. And then assuming that it is an outdoor space, and to your question, Pat, about outdoor structures such as a tent, there are some qualifiers that the guidance from the state health department puts into place in order for those to be considered outdoor settings. So with the tent, the requirement would be that there are 2 non-adjacent sides that are open. And so the reason for that is if you have a tent that is enclosed on all 4 sides, you've essentially created an indoor space where airborne particles are able to be trapped and remain in the air. And that defeats what is trying to be accomplished by encouraging outdoor ventilated areas to reduce the risk of transmission and coming into contact with those airborne particles. So an outdoor tent would be an appropriate setting for outdoor dining, so long as there's 2 non-adjacent sides, so they across from one another, that are open enough to allow airflow through that space. The other option, if the walls are not adjacent, but you have an outdoor setting that has maybe a corner that is walled in, but there's no roof, that would again be permissible because the air can escape through the roof. But if it's enclosed like a tent that has a roof, then you need to have 2 sides open. So, and I'm happy to get into other details if that doesn't totally answer the question, but hopefully that's a good start.
I think that goes a long way towards clarifying, what qualifies as outdoor, especially outdoor covered space, because I do think there have been some questions around that. So I appreciate
Pat,
that.
I'm sorry. I was just going to add one more thing, because I've seen some businesses putting these out, and I did want to confirm that you can have the single party structures that, they're calling them igloos or bubbles or different things that are enclosed. If you have one party, that same household in those structures outside, those are permissible as well. And the reason being, you can air those out between parties. You're containing it to one party versus having multiple parties within the same enclosed space. So thanks for letting me add that part too.
Oh, absolutely. I was wondering how those work. So that's great information. Thank you. And I think Justin dropped something in the comments asking how many people are allowed to sit at one table outside. I remember seeing that spelled out in the guidelines, but could you kind of reiterate that for us?
Sorry, I didn't realize that I had remuted myself. So the qualifier here is that it needs to be parties from the same household. And so I'll let Jason correct me, but I'm not seeing that they put a cap on the number of individuals in the updated language.
No, I don't see that either, Deb.
Yeah.
We can verify and follow up if need be.
Yeah, so at this point, sorry, just to be clear, the language in the public health order just limits to members of the same household, and parties need to be spaced 6 feet apart. But previously, I think Justin's right, there were a cap on the number of diners, but now that the language limits it to same household, it appears that cap has been taken out of the language in the most recent public health order.
All right, great, thank you so much. Do we have any other questions from our attendees today? Anything else that we'd like to ask of our panelists today? We've got Jason Volling and Deb Federspiel from Public Health. We've got Jeff Romine from Economic Vitality on with us. So as a matter of fact, talking about Jeff, I'm going to throw it over to him now to talk a little bit about some of the resources that are available to our businesses as we try to figure out how to move forward. So Jeff, take it away for a moment.
Thanks, Pat. And I believe we have a one-pager that we can share that you might have. Otherwise, people can reach me and I can provide it for you, which summarizes what I'm about to say. Real briefly, many of you have heard of there you go, the Enhanced Broomfield program. That was something that was aimed at businesses. That's been in place since April 1st. We're continuing on that, and then it'll be moving into 2021 with City Council's provided additional funding for it to begin the year. And then depends on how things go. We need additional money. We can always go back to Council. Obviously, as many of you know, Broomfield Small Business Fund, which was created by the Chamber and the Broomfield Community Foundation, has been established. And when you get this, when you click on this, you'll be able to click right to the application point or right to the information and application point. We have right now been running a promotion or a campaign called Broomfield Believes. And the purpose of that is to promote our local businesses, the ones that are really interesting and people want to support. There are a number of different parts of this program, including a business list that's online for restaurants and retail, as well as so many other things we're trying to promote our businesses. One additional part of the program we just added was we are retaining a videographer who is putting together small videos for individual businesses. We're using this as part of our stock in order to promote the community. And so if you want to if you'd like to participate in that, we're welcoming people. And then in the end, you'll get roughly a 60-second promotional video you can use in your social media to promote your business and to encourage both now and as we go into 2021. There are a few other things that you'll note, which are other programs like the SBDC, where you can get additional information. There is the Colorado Outdoor Winter Dining Program, which the Colorado Restaurant Association is running, and there has been some funding there, as well as the Energize Colorado Gap funding. So there's a few other resources. I just want to hit on real briefly, and then I want to conclude. And that is the state of Colorado, as many of you know, just had a special session. They passed a number of programs that are coming forward, and you'll be getting more information from myself or through the chamber about some of these programs. And so I've just briefly put down what those programs are. The one that has the most direct impact or the most immediate impact is for businesses, and these would be restaurant, drinking and or mobile food establishments. You'll be able to deduct the first $70,000 of your taxable sales from your November and December, January and February filings. And so it'll impact you on December 21st to be the first time you'll be able to do that. That will result in roughly a $2,000 savings to you, which while you have collected that sales tax on behalf of the state of Colorado, you'll actually be able to retain that and it'll convert into a grant for you. So That's something, if you need more information on that or any of these other programs, you can contact me at jromine, ROMINE, at broomfield.org, or you can go to our website and find out more. The other part that we wanted to do today with a few minutes that are remaining is City Council's asked us, I'm interested in ideas, suggestions you may have for the city, for things that we should think about in talking to our friends at the state, about other ways that we can help small businesses, restaurants here in Broomfield. Obviously, as Jason's already pointed out, there's the 5-star program that we're investigating, but any other suggestions, we'd love to generate those ideas today. It doesn't, this doesn't end the conversation. This is really the start of a conversation. So things that you believe would help you get through this. As Jason's pointed out, we're in a difficult time. We all see a light at the end of the tunnel, but nevertheless, we know that this is continuing. So what other ideas or suggestions you might have? So I'll turn it back over to you, Pat, and then everybody that's on today's session. If you have other ideas, please suggest them now, or you can email me directly. Thank you. Pat?
Great, Jeff, I appreciate that. Thanks so much for running through that. And the what you saw on your screen, everybody, that list of resources that that the city provided will be available to everyone. If you signed up for this webinar through the Zoom invitation, I will be sending that out to everybody who registered for the webinar. And then I'll also be posting that on our chamber website, and you'll be able to download it from there as well. So as Jeff mentioned, we do have some time left. So if there are any of our attendees today that have any suggestions for the city on things that we should be looking for, or for the Chamber of Commerce, things that we can do to help you move forward. At this time, as a Chamber of Commerce, we do a lot of things that are member related, but we also do a lot of things for the business community in general, because it's an important time for all of us. So until we see anybody that pops into the chat, and again, if you have a question, if you have a suggestion or even a question, pop your name into the chat, and we'll open up your mic and you can address the group here today. A couple of things from a chamber perspective. We do have, if you have not already joined it, we do have a Facebook group called Broomfield Area Business Strong. Just go to Facebook and look up that group. And that is a group that's open to members and non-members, and you can promote your business there. You can promote your specials, your hours of operation, what's going on in your outside dining and your to-go orders, or if you're not a restaurant, you can promote your, anything you want to promote about your business. That is open to members and non-members as a way to get information out there. We have at last count about 750 members in that group, so it's a pretty decent size audience that you're addressing through there. So we encourage you to do all of that. And not seeing any other questions, I want to shoot it around to our group of panelists. Let me know if there's anything that you'd like to address at this point, Jeff or Jason. Anything else that you want to add as we round out this conversation today?
I just want to thank everybody again for the opportunity and the questions. And we all know COVID's complex. It's frustrating. And so just know we as a public health department are here to answer questions. We always do our best to problem solve. Sometimes we have direct control over decisions, and other times we're following either state orders or guidance or federal orders and guidance. So we do see ourselves as being partners, obviously, with the chamber and all of you. And our ultimate goal is to get our transmission levels back down to a place where we can move back to level orange or even more. And I think as we start to see vaccines roll out on top of some of the mitigation that's currently in place, hopefully we get there sooner than we anticipate. So I appreciate everybody's patience, and I know how extremely stressful these times can be for all of you. So I appreciate all that you're doing as well.
And this is Jeff, and I just want to first also thank everybody both on this call, but quite frankly, both the everyone in the business community as well as the residents of Broomfield. You really are doing an awful lot. We recognize that a number of sacrifices that people have made. This community has had a high degree of compliance around face masks, social distancing. Businesses have been at the forefront of working and trying to find ways to meet their customer demands in a very safe and a public health manner. So it's not unnoticed, and it's truly appreciated. And in working with Deb and Jason and everyone, it's just phenomenal. Just the way that the community has responded to this crisis, and our low levels, here locally are testament to that. Obviously, we're in a metro area, so we have impacts on our public health from the metropolitan area too, that sometimes add additional outcomes. The other part, though, is again, the state programs are just starting to come through. We're just starting to get clear understanding of them, and potentially, hopefully, knock on wood, future federal programs will be coming through. Please know that you can always reach out to us for information on those programs. And if you do have ideas and suggestions, I welcome them all the time. We're trying to find ways to support our businesses. The way that we're going to measure ourselves is how we come out of this pandemic and the economic crisis related. So thank you for your help. And we look forward to working with you in the coming months.
Right. Thank you both. I want to leave, Deb, did you have anything you wanted to add to Jason's comments?
Just thanks so much for the opportunity to have dialogue. We want you to feel like your public health department is accessible to you. And so if there's questions that you weren't quite ready to ask or that come up along the way, the easiest way to reach us is publichealth@broomfield.org. And we are happy to connect with you and make sure that you get the information that you need. And then finally, I would kind of echo, in addition to what Jeff said about wanting to know what ideas and things you have, but also if there's questions and things coming up. We've been adding information, for instance, about vaccine on our website. We know that's a big topic of conversation. So please let us know what kinds of things you need in the business community, what kind of information, so that we can continue to make that information available. So thanks again for the opportunity to connect with you all today. Appreciate it.
Great. Thank you all. And I do want to give the last word as such to the president and CEO of the Broomfield Chamber of Commerce, Sam Taylor. He is with us today. And Sam, I know you wanted to say a few words as we end off today's discussion.
Thanks, Pat. I really appreciate it. I appreciate everybody that's here. Had some good conversation, but don't let it end now. We still have a lot of attendees who are still on at the end, but if you have additional questions, Public Health gave their information. You can send questions to us. You can call us, email us. My email is sam.taylor@broomfieldchamber. Any questions you have, if we don't know the answer, which we don't know all the answers, we'll find out, or we'll find out as close as we possibly can. A few people I do want to thank really is the Broomfield Enterprise. They're our websites, or our sponsor for Zoom. I appreciate their support, but I really support the partnership that the city and county of Broomfield, Jeff in particular, has shown us, where, as he said, our success is going to be measured by how we come out of this. You can look at how many dollars we spent, how many businesses received, a cash infusion, what kind of changes we made in the laws. But really what's going to make a difference is, how do we come out of this? How do we look once the vaccines are widely distributed and we can actually start mingling in large groups again? That's going to be the measure of success. And when it comes to shopping Christmas, I, of course, I'm a little bit prejudiced. I think you should spend all your money at all the chamber members. But more than that, local business, whether they're a chamber member or not, the people that work there live in our community. Many of them live here, and by supporting them, you're supporting the community, whether it's property tax, sales tax, it goes back into the community. So go to the mall this weekend. Spend a lot of money, safely, of course. Before you go, wash your hands, put on your mask, keep distance, take some antiseptic with you for your hands, but shop local, because those people that work there, they rely on their paychecks so they can shop local, so everybody can have a good Christmas. So all businesses, any business you can go to, whether it's a restaurant, whether it's a small retailer, even if it's a big retailer, they all are part of the economic fabric of Broomfield. So please do that. And if you do need any more information about the enhanced Broomfield that the city's doing, or the small business fund that the chamber is doing, feel free to reach out to me, feel free to reach out to Pat, or the city. We are more than happy to be part of it. And thank you for being here today, and I hope you have a wonderful day. And back to you, Pat.
All right, thanks so much, Sam. And I do want to echo Sam's sentiment. The Broomfield Enterprise is our webinar partner, and we thank them for for being a partner with us. They allow us to bring you these education series webinars in this format. And their partnership with us, as well as everybody else's, is critical to the work that we're trying to do on behalf of businesses and communities. So we thank the enterprise for their sponsorship of our webinars. To echo up on what Sam mentioned, we do have some shop local posters, support local posters that are holiday themed. They're 11 by 17. We would love to bring one by to your business and allow you to put that up in the window, or wherever you feel it would be great, appropriate. That way, we're encouraging people to not only shop with you, but shop with your fellow businesses, your local businesses, and help support our local economy during this holiday season. So if you are interested in getting a poster, I have taken the opportunity to go and drop several off already. But if you would like one, I have put my email into the chat, patrick.monacelli@broomfieldchamber.com. Shoot me a quick email. Tell me that you'd like a poster, and I will bring one out to you. Or if you have ways to print it yourself, I can also send you a file, whatever is easiest for you. On that note, I would like to say thank you to all of our panelists today from the City and County of Broomfield. Thank you to Sam. Thank you to all of our attendees today. We appreciate everybody being here. Again, this webinar will be available on our YouTube channel after our presentation today. And for everybody that was registered through the Zoom invite, I will get you the link to the, I'll get you the physical or the electronic copy of the resources that Jeff Romine spoke to. So thank you all so much for being with us today. We appreciate it, and have a great day, everybody.